happy to have everyone here. So, in this academy, firstly, we acknowledge God. So, we give God Almighty all the praise. So, in our last class, we, by God's grace, simplified cataract and glaucoma. So, this will be a test of knowledge. Now, like I said, these are past questions, so don't joke with it. Write them down so you can revisit them before your exams. So, we'll be fast and snappy. Always drop your answer in the comment section. So, number one, glaucoma is best defined as A. Inflammation of the cornea, B. Progressive damage of the optic nerve, usually associated with increased intraocular pressure, C. Infection of the retina, and D. Clouding of the lens. So, like I said, it will be fast. And if you choose D, clouding of the lens, you are wrong. If you choose C, you are wrong. I'm impressed with the student that just gave the correct answer during this live section. So the right answer is what B, progressive damage of the optic nerve, usually associated with increased intraocular pressure. Number two, the part of the eye primarily damaged in glaucoma is the part of the eye that is damaged in glaucoma is. So drop your answer. Okay, I'm impressed with the students. I'm impressed. So the part of the eye that is damaged in glaucoma is A, iris, B, lens, D, cornea, and C, optic nerve. So the correct answer is what? C. Very correct, optic nerve. Number three, the normal range of intraocular pressure is approximately what? The normal range of intraocular pressure is what? A 0 to 5, B 6 to 10, C 10 to 21, D 25 to 40. So drop your answer. Okay. And if you choose A, you are wrong. If you choose B, you are wrong. If you choose 25 to 40, you are wrong. So the correct answer is what? 10 to 21 millimeter mercury. That is the normal range of the pressure of the eye. Are we together? Then number four, let's be faster. Which type of glaucoma develops gradually and is often asymptomatic in the early stage? Which type of glaucoma develops gradually and is often asymptomatic in the early stage? Now we have A. Congenital glaucoma, B. Secondary glaucoma, C. Open angle glaucoma, D. Acute angle closure glaucoma. So let's see those that really and truly follow the class. Which type of glaucoma develops gradually, that word gradually, and is often asymptomatic in its early stage? And if you choose A, you are wrong. If you choose B, you are wrong. If you choose C, you are correct. So it's the right answer is what? Open angle glaucoma. It develops gradually and is often asymptomatic in its early stage. So that word gradually is the key word you should not forget. Number five, the most common type of glaucoma is A. Congenital glaucoma, B. Open angle glaucoma, C. Secondary glaucoma, and D. Traumatic glaucoma. So what is the correct answer? The most common type of glaucoma is A. Congenital glaucoma, B. open angle glaucoma, C, secondary glaucoma, and D, traumatic glaucoma. So if you choose D, you are wrong. If you choose C, you are wrong. If you choose B, you are correct. So the most common type of glaucoma is what? The open angle glaucoma. That's the most common type of what? Glaucoma. Don't forget this. Number 6. In open angle glaucoma. Now, if you've been getting this so far, that means you follow the class very well. In open angle glaucoma, the drainage angle is in open angle glaucoma, the drainage angle is A, completely closed, B, narrowed by the iris, C, open but drainage is reduced through the trabecular meshwork, and D, absent. In open angle glaucoma, the drainage angle is A, completely closed, B, narrowed by the iris, C, open but drainage is reduced through the trabecular meshwork, and D, absent. Very simple question. All right, to the student that just got the correct answer during this life, I'm impressed. Yes, I'm impressed. So if you choose D, you are wrong. If you choose A, you are wrong. If you choose B, you are wrong. So the correct answer is C. In open angle glaucoma, the drainage angle is open, but the drainage is reduced through the trabecular meshwork. Number 7. A patient with acute angle closure glaucoma is most likely to present with a patient with acute angle closure glaucoma is most likely to present with A, gradual vision loss only, B, severe eye pain and sudden vision loss, C, no symptoms, D, excessive tearing only. So I want you to think rationally. If this is your exam and you see this exact question, what will you pick? Is it A, is it B, is it C, is it D? Now, if you choose D, you are wrong. If you choose C, you are also wrong. If you choose B, you are correct. So in acute angle closure glaucoma, there is what? Severe pain and sudden vision loss. I explained this in our class. It was well explained in the class because it is acute and there is what? Closure. So there will be what? Severe pain and sudden vision loss. Number 8. Which symptom is most characteristic of acute angle closure glaucoma? Which symptom is the most characteristics of angle closure glaucoma? We have A, the floaters, B, halos around light, C, hearing loss, D, nose bleeding. We are going to be faster. All right. Which symptom is the most characteristics of acute angle closure glaucoma? We have A, floaters, B, halos around light, C, hearing loss, D, nose bleeding. Very correct. I'm impressed with these students that are in this life. Yes, I'm impressed. Now, if you choose D, you are wrong. Some students that choose A, you are wrong. If you choose C, totally wrong. The right answer is what? Glaucoma deals with halos. Don't forget this. Whenever you see halos, know that we're talking about glaucoma. So, halos around light, and it's connected with what? Acute angle closure glaucoma. Write it down. Write it down. All right. So, let's now. Peripheral vision loss is commonly associated with A, cataract, B, open angle glaucoma, C, conjunctivitis, and D, retinal detachment. Peripheral vision loss is commonly associated with A, cataract, B, open angle glaucoma, C, conjunctivitis, and D, retinal detachment. Very simple. Now, if you choose retinal detachment for peripheral vision loss, wrong. If you choose conjunctivitis for peripheral vision loss, wrong. If you choose cataract, wrong. The right answer is what? Glaucoma. Glaucoma deals with what? Peripheral vision loss. That is the first symptoms. There will be what? Peripheral vision loss. Don't forget this. Now, number 10. The aqueous humor normally drains through the what? The aqueous humor normally drains through the A. Retina and optic disc, B. Lens and vitreous body, C. Trabecular meshwork and Skene's canal, and D. Choroid and sclera. Very simple. The aqueous humor normally drains through the, is it A, is it B, is it C, is it D? And if you see such questions, you should know the next class we are going to have is the anatomy of the eye. The anatomy of the eye. I believe everyone here is in the private class. So if you choose A, you are wrong. If you choose B, you are wrong. If you choose C, you are correct. So the aqueous humor normally drains through the trabecular meshwork and the Skene's canal. I believe we are following and we're enjoying the quiz. Number 11. Increased intraocular pressure occurs. Increased intraocular pressure occurs when there is A. Too much blood entering the eye. B. Aqueous humor production exceeds drainage. C. Tears are not produced. And D. The lens becomes opaque. Increased intraocular pressure occurs when A. Too much blood enters the eye. B. Aqueous humor production exceeds drainage. Very correct. C. Tears are not produced. D. The lens becomes opaque. The students here are really impressive. And if you choose D, you are wrong. If you choose C, you are wrong. If you choose B, you are correct. So increased intraocular pressure occurs when there is excessive production of the aqueous humor, or when the production of the aqueous humor exceeds the drainage. There will be what? Increased intraocular pressure. Don't forget, in this quiz, one of the question is the normal range. Don't forget the normal range. Now, number 12. Which diagnostic test measures intraocular pressure? Which diagnostic test measures intraocular pressure? So this intraocular pressure we've been talking about in glaucoma in the private class, we are talking about in this quiz. What diagnostic test is used to measure it in a patient? A, we have gonioscopy. B, we have tonometry. C, we have ophthalmoscopy. And D, we have perimetry. So is your answer A? Is your answer B? Is your answer C? Is your answer D? Giving you some seconds to think. Now, if you choose D, you are wrong. If you choose C, you are wrong. If you choose B, you are correct. If you choose A, gonioscopy, you are wrong. So don't ever forget this, that Nurse Brain is said that whenever you hear of the word glaucoma, which is what? Increased intraocular pressure. The first diagnostic test you are going to think of is what? Tonometry. That's the first diagnostic test you should think of. Are we together? Glaucoma, tonometry. Write it down. Glaucoma, tonometry. Don't forget this in this quiz. Don't forget the normal intraocular pressure. Don't forget that about the peripheral vision loss. Don't forget about the halos around the eyes. Don't forget about tonometry that is used to measure the pressure of the eye. Okay, having said that, now what is this gonioscopy? gonioscopy used to examine. So number 13, gonioscopy is used to examine the A, retina, B, lens, C, drainage angle of the eye. Is used to examine the A, retina, B, angle of the eye, and D, cornea only. So gonioscopy is used to examine the retina. Wrong. Lens. Wrong. So the correct answer is what? The drainage angle of the eye. Gonioscopy is a test used to examine the drainage angle of the eye. Don't forget this again. Gonioscopy is a test used to examine the drainage angle of the eye. Number 14, the visual field test is used to dictate. The visual field test is used to dictate A, color blindness, B, peripheral vision loss, C, corneal ulceration, and D, refractive errors. The visual field test is used to dictate A, color blindness, B, peripheral vision loss, C, corneal ulceration, and D, refractive errors. So whenever you hear of the word gonioscopy, remember, must when say this for the examining, scopy, this with examination, gonioscopy, examining the drainage angle of the eye. Tonometry used to measure a diagnostic test used to measure the intraocular pressure of the eye. Visual field test is from the word field. It deals with a large space. Visual field test is used did not color blindness. If you choose color blindness, you are wrong. If you choose corneal ulceration, you are wrong. If you choose refractive error, you are wrong. So the right answer is what? The peripheral vision loss. Visual field, peripheral vision loss, gonioscopy, drainage angle of the eye, tonometry, the intraocular pressure of the eye. I believe you are learning something in this quiz. All right, thank you. Now, a major risk factor for glaucoma is A, young age, B, family history of glaucoma, C, low blood pressure only, D, excessive sleep. So no need, I believe everyone should know this, that the right answer is what? B, family history of glaucoma. Number 16, which medication decreases aqueous humor production? Which medication decreases aqueous humor production? These are past questions. Don't joke with them. These are extracted past questions. Don't joke with them. And if you choose Timo, what is the answer? Timolol? Is the answer artificial tears? Is the answer atropine? Is the answer tropicamide? So what is your right answer? And if you choose D, you are wrong. If you choose C, you are wrong. If you choose at B, you are wrong. The right answer is what? Timolol. It is a medication used to decrease aqueous humor production. Remember from our private class, simplified private class, the aqueous humor is produced in the ciliary body, and the medication that can be used to decrease the aqueous humor production is what? Timolol. Are we together? All right. 17. A patient says, I can see clearly in the center, but still bumps into objects at the side. Visual test. That's one of the visual tests. Now, if you've been following in this quiz, you should know the right answer of this. A patient says, I can see clearly, but I can see clearly in the center, but bumps into objects on this at the side. This suggests A, cataract, B, macular degeneration, C, glaucoma related peripheral vision loss, and D, conjunctivitis. Now, if you choose D, you are wrong. If you choose C, you are correct. So, peripheral deals with side. So, this patient is saying that he or she can see clearly at the center in front of him or her. But because of glaucoma, when a patient is having glaucoma, there will be peripheral vision loss. The person will not be seeing things by the side. Imagine a patient with glaucoma driving a car. You can't see the car by the sides. You only see what? The front mirror. You can't see anything by the side. So the right answer is what? C. The right answer is what? C. Glaucoma related peripheral vision loss. Number 18. The cupping seen during eye examination refers to the damage of the A. The cupping seen during eye examination refers to damage of the A cornea, B lens, C optic nerve. So what is the right answer? And if you choose cornea, you are wrong. Now you can pause. This quiz is to help you assimilate, to help assess you, and to help you have that ability to answer questions very fast. So in case you think I'm fast, you can pause and try. I won't let there be a trial. I want you to be trying. When you try, you increase the capacity of your brain. Are we together? So if you choose cornea, you are wrong. If you choose lens, you are wrong. If you choose optic nerve, optic disc, you are correct. Are we together? Now, number 19. Which glaucoma condition is considered an ophthalmic emergency? Which glaucoma condition is considered an ophthalmic emergency? A. Chronic open angle glaucoma. B. Secondary glaucoma. C. Acute angle closure glaucoma. And D. Congenital glaucoma. Which glaucoma condition is considered an ophthalmic emergency? A. Chronic open angle glaucoma. B. Secondary glaucoma. C. Acute angle closure glaucoma. And D. Congenital glaucoma. This is very simple. Very simple. Let's know students that will get this. Those that attended the private simplified lecture in the Telegram room chat will be able to answer these questions. Now, from the word ophthalmic emergency. Now, if you choose A, you are wrong. If you choose B, you are wrong. If you choose C, you are correct. The right answer is what? Acute angle. Acute is an emergency. Acute angle closure. Emergency. Glaucoma. Are we together? So congenital wrong. So the right answer is what? C is the correct answer. Number 20. A nursing priority for a patient with acute angle closure glaucoma is to A nursing priority for a patient with acute angle closure glaucoma is to A. Delay treatment until morning. B. Reduce intraocular pressure immediately. C. Encourage reading. And D. Restrict fluid intake for 24 hours. So, what is the nursing priority for a patient with acute, that's an ophthalmic emergency, angle closure glaucoma? So, reduce fluid intake, that's D. Encourage reading, that's C. Reduce intraocular pressure immediately, that's B. And delay treatment until morning. Very simple question. So the right answer is what? B. Reduce intraocular pressure immediately. Because it is an ophthalmic what? Emergency. And what does ophthalmic emergency mean? It can lead to what? Blindness. Irreversible blindness. 21. In open angle glaucoma, vision loss usually begins with vision loss usually begins with A. Central vision, B. Color vision, C. Peripheral vision, and D. Near vision. Very good question. Peripheral vision and D. Near vision. So what is your answer? Now, if you choose D, you are wrong. Vision, you are wrong. If you choose color, number 22. Which structure is directly compressed and damaged by elevated IOP in optic nerve fibers? C. Cornea, and D. Conjunctivas. So, which structure is directly compressed and damaged by prolonged elevated IOP? Now, if you choose cornea, you are wrong. If you choose conjunctiva, you are wrong. Optic nerve fibers. Remember from our last class in the private class, what is the definition of glaucoma? I gave a simplified shortcut when group A and group B is affected, but it eventually leads to glaucoma when group B is affected, and the group B is the what? The optic nerve fibers. Whenever the optic nerve fiber is damaged, there will be what? Glaucoma, which will uh, lead to what? Permanent blindness. So, for being in this quiz, the structure that is directly compressed and damaged by prolonged elevated IOP is the what? The optic nerve fibers. 23. Why is glaucoma called the silent thief of sight? Why is glaucoma called the silent thief of sight? A. It causes painless gradual vision loss. B. It causes complete blindness overnight. C. It affects hearing first. And D. It always causes pain. You are wrong. If you choose B, you are wrong. The right answer is what? A. It can cause painless gradual vision loss. Painless gradual vision loss. 24. A patient with untreated glaucoma is at A patient with untreated glaucoma is at the greatest risk for C. Corneal ulceration, and D. retinal. A patient with untreated glaucoma is at the greatest risk for. Now, if you've not, so that when we go live, you will get notified immediately and you can join the live. I always advise students to join the live so that they can ask questions, so that they can participate real time. So click on the notification bell so that you will join real time as always. A patient with untreated glaucoma is at the greatest risk of A. Cataract formation, B. Permanent blindness, C. Corneal ulceration, and D. Retinal infection. So, what is your right answer? The right answer is what? Permanent blindness. Glaucoma leads to what? Permanent what? Blindness. Standing of health education. Which statement by a patient with glaucoma indicates understanding of health education? Number A, we have I. B. Glaucoma treatment usually continues for life. C. Missing medication occasionally is harmless. And D. Lost vision can always be restored. So, what will indicate that a patient understands the health education of glaucoma? So, if you choose D, you are wrong. If you choose C, you are wrong. If you choose A, you are wrong. The right answer is what? B. Glaucoma treatment usually continues for life because it's just like BP of the eye. So, you keep treating it, you keep managing it. Number 26. A patient has an open drainage angle but poor aqueous humor outflow. The most likely diagnosis is A. Acute angle closure glaucoma, B. Open angle glaucoma, C. Retinal detachment, and D. Cataract. Very simple question. A patient has an open drainage angle but poor aqueous humor outflow. The likely diagnosis is A. Acute angle closure glaucoma, B. Open angle glaucoma, C. Retinal detachment, and D. Cataract. So, what is the right answer? So now, if you choose C, you are wrong. If you choose D, you are wrong. If you choose A, you are wrong. The right answer is what? B. Very simplified in the private class. Okay, are we together? Yes, we are together. Now, number 27. Which structure actually becomes blocked in most cases of open angle glaucoma? Very simple question. Which structure usually becomes blocked in most cases of open angle glaucoma? A. Optic nerve, B. Lens capsule, C. Trabecular meshwork, and D. The retina. Which structure usually becomes blocked in most cases of open angle glaucoma? Now, if you choose D, you are wrong. If you choose A, you are wrong. If you choose B, you are wrong. The right answer is what? C. Trabecular meshwork. So it is the trabecular meshwork in open angle glaucoma that is usually blocked. This is well simplified in the private lecture room. 28. The optic nerve damage seen in glaucoma is primarily due to A. Excess tears, B. Increased pressure and reduced blood supply to the nerve fibers, C. Infection, D. Corneal edema only alone. The optic nerve damage, that is, what is this explaining? The damage of the optic nerve seen in glaucoma is due to A. Excess tears, B. Increased pressure and reduced blood supply to the nerve fibers, C. Infection, D. Corneal edema alone. Now, if you choose D. Corneal edema alone, you are wrong. If you choose infection, you are wrong. If you choose increased pressure and reduced blood supply to the nerve fibers, you are correct. Now, if you choose SSTs, you are wrong. So the right answer is what? Increased pressure and reduced blood supply to the nerve fibers. So whenever the optic nerve is damaged, whenever the fibers are damaged, it's as a result of what? Increased pressure and reduce blood supply. The pressure in the eye is too much, so there will be what? Reduction of blood supply to those fibers. That's why it's what? Optic nerve fibers. Now, number 29, second to the last. I want you to drop how many questions you got correctly. Let me know how much you know about glaucoma. So I want you to drop how many questions you got correctly. Number 29. A patient reports severe eye pain, nausea, vomiting, halos around lights, and blurred vision. What should the nurse suspect? A patient reports severe eye pain, nausea, vomiting, halos around lights, and blurred vision. What should the nurse suspect? A. Cataract. B. Conjunctivitis. C. Acute angle closure glaucoma. And D. Presbyopia. A patient reports with severe eye pain, nausea, vomiting, halos around light. This question is a question likely exam nursing council question, midwifery council question. Don't joke with this question. Now, if you choose presbyopia, you are wrong. If you choose conjunctivitis, you are wrong. Now we have cataract and glaucoma. Now, but there are key, defined, precise terminologies that we indicate whether it is cataract or what glaucoma. Now we have number one, severe eye pain. We have blood vision. Cataract, there can be blood vision. That's why we are trying to separate these two. Now, but we have halos around light. So definitely the right answer will not be cataract. The right answer is what? Glaucoma. When you see peripheral vision loss, when you see eye pain, when you see halos around light, when you see increased intraocular pressure, when you see tonometry, when you see gonioscopy, you should know that we are talking about what? Glaucoma. But when you see cloudiness, blurriness, we know we're talking about what? Cataract. All these terminologies have been well simplified in the private lecture room on Telegram. So if I haven't sent you the link, notify me. Finally, number 30. Which finding would be expected last in untreated chronic glaucoma? Which finding will be expected last in an untreated chronic glaucoma? A. Peripheral vision loss. B. Increased IOP. C. Optic nerve cupping. And D. Complete blindness. I love this question. This question looks statistical. It covers almost all the signs and the symptoms of glaucoma. So let's know those that will give the definitive and correct, precise answer. So, which finding would be expected last in an untreated chronic glaucoma? A. Peripheral vision loss. B. Increased IOP, intraocular pressure of the eye. C. Optic nerve cupping. And D. Complete blindness. And if you choose A. Peripheral vision loss, that is not expected last. So you are wrong. If you choose increased IOP, that is not what should be expected last, so you are wrong. If you choose optic nerve cupping, that is not what will be expected first, but it should not be expected last, so you are wrong. So the right answer is what? Complete blindness, irreversible blindness, permanent blindness. So the right answer is what? D, complete blindness. Now, notify me, did you learn something from this quiz? One of the key feature of our quizzes is that number one, it is nursing council based and extracted. Number two, help you answer question fast and help you think rationally. Number three is a source of is a kind of an assessment and appraiser. And number four, there is something new that you must learn. There is something new that probably I didn't say in the private class that I will say here. So one of the things we are learning from today's quiz is number one, the normal intraocular pressure. So I want you to write it, all these things I'm going to list now. Number one, write it in the comment section or chat me on WhatsApp with your answer. Number one thing you are sending to me is how many questions you got correctly. I want to appraise you. Number two, this will be a source of attendance. Number three, look at these questions. I want you to answer them and send it to me either in the comment section or directly to my WhatsApp. What are the questions? Number one, what is the normal intraocular pressure of the eye? Number two, what will be damaged that will lead to blindness? Number three, what is gonioscopy used to examine? Number four, what is the work of tonometry? Number five, what is visual field used to test? Visual field test, what is it used to test for? The next one, what is the first symptom that will be seen in a patient with glaucoma? What is the first symptom that will be seen in a patient with glaucoma? And the last one, with your own understanding, differentiate in one sentence, differentiate glaucoma from cataract. So if you follow this class, I want to say God bless you. We always start in this academy with God and we close with God. So God bless you, God bless you, God bless you, God bless you. Send me how many questions you got correctly and the answers to these questions I just asked. God bless you. Let's move to the WhatsApp group.